Can the diabetes be cured? Of course it can, but only the type 2 variant. I'm Dr. Krish, a GP and a physician in the UK. Join me and I'll tell you how. Now, most people have this misconception where diabetes is for life and that you cut down your sugary and fatty food and that you beginning to exercise and change some lifestyle, take your medication, and you can live near normal life, but it cannot be reversed. That was a general conception, even among doctors, for years. Now, resolving diabetes has become entirely possible with introduction of this latest injectable medication and the combination of all the medication as well. But most importantly, what matters is the change of attitude and the approach to diabetes. Imagine you're diagnosed with some form of cancer where you get really desperate to get rid of quickly. So you would consider chemotherapy, radiotherapy, some form of operation to remove it so that the cancer will be cured and that you would go into remission, and you hope that that would not come back, like it won't relapse. So imagine if you have the similar approach when you're diagnosed with type 2 diabetes, that you treat aggressively up front and try bring down what the diagnosis made your sugar levels, the HbA1c, drastically down to pre-diabetic levels. Now, as I mentioned before, there's medications recently introduced as being playing a key role, but at the same time, your lifestyle changes also make a massive difference. Now, understanding how you got into diabetic state is more important, because you need to understand how the body has adapted over the years of abuse, years of using alcohol, smoking, sedentary lifestyle, gaining steady weight over the years with excessive fatty food, excessive carbs and sugars, and also in some cases the genetics, especially in South Asians. So knowing all of that would be a key thing that you can start to reverse when you actually diagnose diabetes. Now, we treat majority of the diabetic patients in our locality, in our clinics. And what I see recent years is that with the new medication as well as the change in approach, people have bring their HbA1c, the sugar marker has right down. And speaking to some of these patients in their experiences and their journey, I realized they worked really hard and they changed their attitudes towards diabetes. So they knew if they follow that guidance and follow this approach, they can surely see results. In some cases, they actually resolve the diabetic status by bringing their sugar levels down less than 41 of the HbA1c, and also bring their medications really down to stop them. And after 6 months, when they check if their sugar levels not elapse over 41, that we put down in the computer system that diabetes is resolved. Now, there's only a small proportion of people who achieve that, but for it to happen, you need to treat aggressively and tackle this problem head on. Now, when I speak to some of these patients who actually manage to resolve their diabetes, first thing I realize is that the change of the mentality and their approach, as I mentioned. Now, they had a better understanding what this diabetes is all about. Now, they knew that the diabetes is their sugar levels has gradually increased. The marker we call is the HbA1c is gradually crept up from their 40s into above 48. Now, once you have two readings independently over 48, we mark them as type 2 diabetes. Now, from there, they realize with the knowledge that's available out there, the diabetes affecting their organ systems, including your heart, your kidneys, your eyes, your skin, and the rest of the body, they knew they need to do something, as I mentioned before, treating like a cancer aggressively. And that's what they opted to. And also they were quite honest about how they've been abusing their bodies over the years and how their weight has gained over a certain period of time. And this is where they made the start. So all that abuse need to stop. And they start first with weight loss. Now most people, when they started their body weight, or we call body mass index, were mostly above 30. Now that is we categorize as clinically obese. Now from there, they realized that has caused insulin to become resistant, so that your sugars always get deposited in your body rather than getting rid in normal people. So first of all, what they did was try and bring down this body mass index, or weight loss essentially, to manageable level, BMI up to 25. In Asian communities, we recommend even bringing down to even 23. That's made a huge impact, bringing this HbA1c down from 60s to 50s to 40s. Now, once you have that, it is become much easier to manage, along with combination of medications now available, to keep the sugar levels in a manageable level. With that, we always recommend people to be really religious with their food. Now, obviously, the facilities nowadays, the diabetic patient will have education programs. Now they have access to dietitian, and a physician and endocrinologist in some cases, a GP, as well as a healthcare advisors constantly in their ears to keep them motivated. Now, you don't need all of that if you have the understanding what led to this diabetes in the first place. Now, I'm not going to details of some of the medications you can take, because it is individually catered and it's not wise to give one plan to everybody. But one thing you need to understand is that when you're diagnosed, ask your doctor, can I go on a combination medication rather than just one medication? Because you show the interest that you want to bring your sugar level dramatically down. And while doing that, you also need to show the commitment to bring your weight down and reverse your sedentary lifestyle to active lifestyle. One more thing that you need to understand, some of this medication is actually working on your brain satiety center to reduce your appetite. So that you would not be hungry to eat more. So that is one of the key things that some of these new medications brings in. Medications like semaglutide and tirzepatide, those have been a revelation in last 3-4 years to bring the weight down so that the insulin resistant can be get rid of. And then from there, the activity levels and also keeping the tone of your muscles. You need to understand that the once the weight loss has started, you're not going to be losing weight where your preferred places are, like your buttocks or your tummy or your chin or your neck. It is not what's the way it happens. It's generally, it starts from your visceral fat inside. And also you're going to start losing the fat around the skin, and you'll see the difference where some instances where you lose some of your muscle mass as well. That's where you see certain patients be on weight loss drugs and some of these anti-diabetics, you lose a bit of shape. To avoid that, you need to be active, and you need to be using certain strength training exercises to keep your muscle tone and muscles engaged. Now we recommend things like at least walking 20-30 minutes a day at least, and also start to use body weight exercises, your yogas and pilates. And also most people I spoke to who started using not just going to gym, but having something like a kettlebell, so you can engage all of your muscle group with one particular instrument. Use your arms and shoulders, your abs, and also your glutes and legs with your lunges. So that is the important part, keeping your exercises and your cardiovascular health while you're going on the weight loss journey, as well as treating diabetes. The other thing is your portion sizes. Now the portion sizes needs to cut down to minimum manageable level. Everybody knows you need to cut down excess carbs and reduce your high glycemic index food. Stick to clean, lean legumes, proteins, and enough hydration to get rid of your excess metabolic products that is produced from the fat burning process that you're going through. So that is most important thing. The rest of it, along with all the advice from the dietitian and your doctors, it will beginning to show results. Now, you have to be really disciplined to follow this plan, and you will see results 6 to 12 months at least, in some cases, year or 2 or 3. But you need to stay on course. You need to constantly monitor your progress with the weight loss, progress with the rate of the decline in the HbA1c, and also look at how's your other organ functioning. You need to also understand if your kidney is beginning to affect, your eyes beginning to affect, you need to treat them quite abruptly and quite promptly, because once you come to the stage where your kidney is beginning to fail, it's very difficult to reverse, because the kidney failure is becoming irreversible. So does your retinopathy or maculopathy in your eyes can become irreversible. Although it's treatable, you always lose certain amount of sight. Therefore, not allowing to get into that stage is the key thing, and how you do it is you treat your diabetes quite aggressively up front. Nowadays, everybody wants to go on this weight loss medication in order to achieve better diabetic control. Now, you need to ask yourself, am I ready for the massive weight loss and the side effects that comes with it? Can I have the discipline to stick to the course that diabetes needed? And I think you need to ask your question first, and ask your GP or your doctor who's treating whether you're right candidates to start on some of this medication. Especially if you got already have kidney issues, or you have vision interrupted with your diabetic retinopathy or maculopathy. Some of these new medication like tirzepatide cannot be started in retinopathy certain stages. So you need to be absolutely clear that these are not affecting your ability to take those medication. Otherwise, it can be a vicious cycle where you can't take medication, therefore you can't achieve your weight loss targets, and you're going to be stuck with some of these conditions for life. So this is why I emphasize again, moment you diagnose diabetes, you make a massive change in your lifestyle and make sure you try and do everything you can to reverse this stage. Now, when it comes to curing diabetics, I believe you need to understand what I meant by curing, because like cancers, you can go into remission, but it can relapse. Diabetes is the same thing. You can bring your sugar levels down along with the medication. It can be down to pre-diabetic range first, which is your HbA1c from 42 to 47. That is your first stage. Once you achieve that, you can bring your sugar down next to 41 or below. Now that level, you are not a pre-diabetic, you are normal as it can be, but you're on medication. So that is not normal. So your diabetic still hasn't cured. Now with the weight loss, with the diabetic so lifestyle changes, with your exercises, with your all the lifestyle modification you made, you can maintain your HbA1c less than 41, but the help of medication. Now, that stage, we as doctors have a discussion to cut down your medication slowly and steadily until your HbA1c remain 41 or less, but your medication has been stopped. Now, once you have that stopped, then you carry on with your all these lifestyle changes and maintain your HbA1c level less than 41 over 6 months period. When you check it and that confirm, then we can confirm that you are diabetic status resolved or cured. But you need to understand, if you go back to your old habits, and your weight can creep up, your sugar levels can creep up, and you can become pre-diabetic again and eventually become a diabetic. So it is possible, but it's not easy. That needs huge amount of willpower and determination and discipline to carry on. One last thing I want to emphasize on your diabetic journey into the cure is to getting used to the state of being hungry. What I mean is that your visceral fast needs to be resolved slowly and steadily. How to do it is also, which is also kindly becoming a trend at the moment, to fasting overnight and carrying on a bit more, almost like extended fasting. So how you achieve that is you have your evening meal or supper around 6 o'clock, early as possible, and leave it your next meal until next day 8 o'clock in the morning. So in that way you are actually have fasted overnight around 14 hours without thinking too much. And how you do it, you just start with only drinking water or fortified mineral water in some cases, just to help flushing down the metabolic product that comes out on fatty dissolving process during nighttime. Now with time you can increase this timing from 6 o'clock evening meal and breakfast or some sort of food from 8 o'clock to 9 o'clock to 10 o'clock in the next day. That way you're increasing your fasting period, have a good night's sleep to increase your metabolism and breaking down your fatty acids in your deposits in your visceral area. When that happens, your body also getting used to it. Initially you might feel hungry, and also with time your stomach beginning to shrink as well. With that, you won't be able to eat a big meal after a certain period of time, and I think it's a good thing when you're in the process of losing weight and maintaining it, because as your age progresses, your metabolism slows down and need for those extra fatty food or any kind of foods become less and less. So you can maintain yourself with minimum amount of energy or calories with hydration, and also obviously with the minerals and your micronutrients. If you have find a ways to nourish with those and avoid those bigger meals and including fat and excess carb, you are essentially cutting down your weight with the calorie deficit, and also it is helped by extended periods of fasting. Finally, I want you to think and understand the transformation you're going to go through during this process. You are going to be lean and in a state where you maintain yourself in the minimum amount of calories and a lot of exercises and healthy lifestyle. You need to dream and establish yourself as this person with lots of discipline. And there's no cheat days when you start this process. You have to religiously process what you thought's going to work out, and you're going to stick to it. And once you do that, you realize your life has transformed. Your diabetes is not going to come back, but because you're going to stay your body mass index less than 24 or whatever the target you set out, and whatever has worked for you, and then you carry on no matter what. There's no distractions. There's no things that you're going to fall back into your bad habits. You're going to follow that plan and store there, and you reverse completely the process that made you diabetes. Good luck.